Changing healthcare is like trying to move a graveyard. Welcome to The Spectrum. I'm Colleen Marshall. Former Clinton-era Health and Human Services Secretary Donna Shalala says that's what a Harvard professor had to say about America's healthcare system. I joined Shalala on stage at Ohio State University's inaugural Community Engagement Conference. Community and healthcare leaders from all over the state came to OSU for the two-day conference, focusing on partnerships, health, wellness, and the politics of healthcare.
Well, it's a very fragmented system, and we've created it that way through economic incentives.
Donna Shalala told the conferees we pay young doctors much more to become specialists, so they're lured away from family medicine practices. Specialists are expensive, pharmaceutical costs are skyrocketing, medical advances are costly.
And as a result, we spend a lot more money than any other country in the world. Great academic health centers have doctors who are specialists in every part of the body. Now, we want them because we want them to push the field. But when it comes to an individual's care, we're not coordinating it as well as we should. More importantly, Americans think they should pay less, and they probably should. They're paying a lot more than people are in other countries for their health care. And it's in large part because of the way we've organized the finances of health care and who the stakeholders are who make money out of this fragmentation.
And those stakeholders put so much pressure on the people who could make changes, don't they? I mean, when you think about it, the stakeholders who are making all this money are also the people who are going to lobbyists and paying to influence the people who could make changes to make a difference.
That's exactly right. But I once had a student, I asked a single question for a final exam. I said, if you had to tell the president to do one thing, what would it be that would make healthcare more affordable and more accessible to people? And a young man wrote one sentence: campaign finance reform. I gave him an A.
She says Congress gets enormous pressure from stakeholders and lobbyists.
Healthcare is a big business in this country. It creates a lot of jobs. So if you want to squeeze it in one part, some people are going to lose their jobs. And it's not just the executives. It's good people that get up every day and take care of their families.
Shalala supports Ohio State's efforts to connect with community partners to find innovative ways to work for health and wellness here in Ohio.
Some of what's going on in Washington is scary. I wish the president would get rid of his Twitter account. If he got rid of his, I would get rid of mine.
There has been talk that you should run for Congress. Is that something you would consider?
Well, at this point in my life, I can consider anything. I've got a long resume. There's nothing I need to add to it. And at the end of the day, I'm a patriot. I've got civil service. I've got public service in my blood. And I'm increasingly disturbed about what's going on in Washington, particularly their seeming lack of knowledge about things that will help people. And I mean people. When I teach students, I tell them they have to understand people's lives. I walk into a big ballroom and I usually know the people that are serving us, what kind of health insurance they have. Everybody in the ballroom that's coming to hear me talk about healthcare usually does not. But if you don't understand people's lives, you can't make public policy.